My name is Colleen Frank, Collenfrank. Just going to do a quick 360 of the room. Okay, so the patient's temperature was 39.7 degrees Celsius, which suggests an infection. I'd anticipate administering antibiotics, providing hydration, and obtaining blood cultures to rule out or confirm sepsis. The heart rate is 115 beats per minute, which would be related to pain, fever, dehydration, infection, or anxiety. I would be monitoring the heart rate closely, consider an ECG if necessary, and anticipate orders for pain management and IV fluids. The respiratory rate is 22, which could be in response to infection, pain, or early respiratory distress. I would reposition the patient to comfort, provide oxygen if needed, and ensure continuous monitoring of oxygenation saturation. Okay, headache?
Yes, and my neck is really stiff.
Seizures?
No.
Tremors?
No.
Weakness?
No.
Difficulty speaking, swallowing?
No.
Vertigo?
Yes, I feel dizzy, and it's making me nauseous.
Numbness and tingling?
No.
Head injury?
No.
Shortness of breath?
No.
Cough?
Yes, I have a cough, but it's not too bad.
Productive secretions?
No.
Pain with breathing?
No, but my chest hurts a little bit.
Okay, so I'm going to ask you some pain questions about your headache. Okay, so when did this begin?
A day ago, and it's getting worse today.
Okay, is there anything that makes it better or worse?
Movement and lights makes it worse, and just close my eyes falling asleep.
Okay, can you describe the type of pain it is to me, the quality of the pain?
It's like a throbbing.
Throbbing? Okay, and where is it?
All over my head.
All over your head. Does it radiate anywhere else?
No, it doesn't. I just feel fatigued, tired, and dizzy.
Okay, the severity?
The worst, it's about an 8 out of 10.
Does it come and go, or is it constant?
It's all the time.
Okay, and what have you done to try and treat this?
I tried to take Advil and Tylenol, but it's not working.
And have you had this kind of pain before? Like, do you understand? Like,
no, I just feel sick.
Okay, so I'm gonna do a neuro assessment on you. If you could take your glasses off, please. Okay, so I'm just gonna check your pupils. Okay, and you can give me my hands a quick squeeze. Okay. And then I would be checking his feet to push back on them. Okay. So on the physical assessment, the patient appears unwell but tidy, alert, and orientated with no signs of confusion or agitation. There are no tremors or weakness noticed. Hand grip and leg strength are equal on both sides. The patient has a steady gait when walking into triage. His Glasgow Coma scale would be a 15. He opens his eyes spontaneously, responds appropriately to questions, and follows commands. Also, his pupils are round, equal, and reactive to light. All right, so sir, I'm just going to do a quick cardiac assessment. So there would be 5 points on the chest that I'd be listening to. I would be listening for 60 seconds at each site. Okay. I would also be checking his radial pulses for seeing if they're equal and reactive. And I'd be checking his capillaries for cap refill. Okay. The next thing that I'm going to do is a respiratory assessment. So I would be wanting to look for any signs of cyanosis, difficulty breathing, shortness. I would want to look for that barrel chest to make sure that I would be checking his position to make sure that he wasn't like in that tripod position. And then I would be asking you if you could take some deep breaths in and out when I be doing it. So I'd be listening 18 spots on the front. And if you turn, and 10 spots on the back. Okay, so the breathing is unlabored at rest. On auscultation, there's mild bronchially hurt at the bases bilaterally. It could suggest mucus accumulation. I didn't notice any crackles or wheezing. So my initial nursing interventions would be isolation precautions, droplet contact precautions given possible meningitis. I would also be doing a PCR test. I would want to be monitoring his neural status closely, watch for signs of increasing intracranial pressure or deterioration. And for my SBAR, so we have a 17-year-old male presenting with headache neck stiffness, fever, nausea, dizziness, and a mild cough. His background includes type 1 diabetes that is poorly controlled with no recent head injury. My assessment is that the findings suggest possible bilateral meningitis. My recommendation is to proceed with an urgent CT scan of the hand, a lumbar puncture, and blood cultures. I would also recommend starting empiric IV antibiotics, providing IV fluids for hydration, and maintaining appropriate isolation precautions. And then my anticipated physician's orders would be blood cultures and lab work, so CBC lights, and to rule out infection, a CT head prior to lumbar puncture for the cerebrospinal fluid analysis, antibiotics, stat, and then IV fluids for possible IV for the dehydration.